The medicine cabinet is a common fixture in many homes, often filled with various pills, ointments, and syrups, some of which may be past their expiration date. This raises an important question. Can expired medicines kill you, or do they still work? Understanding the effectiveness and safety of expired medications is crucial for maintaining good health and making informed decisions about their use. What does the expiration date mean? The expiration date on a medicine indicates the last date the manufacturer guarantees the full potency and safety of the drug. This date is based on stability testing conducted by the manufacturer, which determines how long the medication retains its intended strength and effectiveness under specified storage conditions. Factors affecting the effectiveness of expired medicines. Several factors can influence whether an expired medicine remains effective or safe to use. Chemical stability. Over time, the chemical composition of a medication can change, potentially reducing its effectiveness or altering its safety profile. Some medicines degrade faster than others, making them less reliable after their expiration date. Storage conditions. Proper storage is vital for maintaining a medication's potency. Factors such as temperature, humidity, and exposure to light can affect how long a medicine remains effective. For instance, storing medications in a bathroom where humidity levels are high can accelerate degradation. Form of medication. The form of the medication also plays a role. Solid forms like tablets and capsules tend to be more stable than liquids, which are more prone to contamination and degradation. Safety concerns. Using expired medications can pose several risks. Reduced efficacy. The most common concern with expired medications is that they may not work as intended. This is particularly critical for medications that treat chronic conditions or infections where ineffective treatment can lead to complications or worsening of the condition. Potential for harm. While rare, some expired medications can decompose into harmful compounds. For example, certain antibiotics and life-saving medications like nitroglycerin can become toxic or less effective over time. Bacterial growth. Liquid medications such as syrups and suspensions are more susceptible to bacterial contamination after their expiration date, posing a risk of infection. Can you use expired medicines? The answer to whether you can use expired medicines isn't straightforward and depends on various factors. Here are some general guidelines. Non-critical medications. For over-the-counter medications that treat minor conditions such as pain relievers or antihistamines, the risk of reduced efficacy is generally lower. However, it's still advisable to replace expired medications when possible. Critical medications. For prescription medications, especially those used to treat serious or chronic conditions, e.g. heart medications, insulin, antibiotics, it's essential to adhere to the expiration date. Using expired medications in these cases can have significant health implications. Consult a pharmacist. When in doubt, consult a pharmacist or healthcare provider. They can provide guidance on whether a specific expired medication is safe to use or recommend an alternative. Proper disposal of expired medications. To prevent potential risks associated with expired medications, it's important to dispose of them properly. Here are some tips for safe disposal. Drug take-back programs. Many communities offer drug take-back programs or events where you can safely dispose of expired or unused medications. Disposal in household trash. If no take-back program is available, you can dispose of medications in household trash by following these steps. Remove the medication from its original container and mix it with an undesirable substance such as coffee grounds or cat litter. Place the mixture in a sealed plastic bag before throwing it away. Flushing. Some medications, particularly those with a high potential for abuse, may have specific disposal instructions recommending flushing. Check the FDA's guidelines for a list of medications that can be safely flushed.